features of type 1 diabetes in older adults and impact of isCGM Association of British Clinical Diabetology study. The stage is yours.
Hello everyone, thanks for having me. So I'm a consultant diabetologist based in UK, and this is a study from the Association of British Clinical Diabetologists, and my co-authors are named here. So this study has two main objectives. So first thing, we wanted to look at the effect of, look at the clinical features of people with type 1 diabetes, especially in the older cohorts, like more people who are more than 80 years old, because there are very few or limited data available on this. And the second thing we wanted to look at is the effect of intermittently scan CGM or isCGM in people with living with diabetes, because there are hardly any data about use of diabetes technologies in older adults living with diabetes. And there's a concern that older adults might not be able to utilize this technology effectively. So we've categorized the data into three sub-cohorts. So we categorize the older adults as young old, 65 to 75, middle old, which is 75 to 85, and old, which is more than 85 years old. So this study was performed as a part of the Association of British Clinical Diabetologists audit for FreeStyle Libre, performed in around 117 hospitals across the UK. As I said, we categorize the older population into three subgroups. We use the standard statistical tests for analysis, and all the analysis was done in R. So quickly looking at the baseline characteristics of this cohort, there were around 1,171 young adults, 324 middle old adults, and 47 old adults. So as expected, the duration of diabetes was higher in the old population, but the interesting something to think about is that the gold score or hypoglycemia awareness was worse in older adults living with diabetes. The use of technology or the insulin pump use was also less, and the older adults were also less likely to have the diabetes education. So first thing which we looked at was HbA1c, diabetes distress, and hypoglycemia awareness measured by gold score across the three cohorts. So you can see that HbA1c, diabetes distress, and gold score improves with the use of isCGM in the young old and the old, but showed some trend towards significance in the middle old adult. If we look at this If we look at this even more closely, then we can look at the moderate to severe diabetes distress and hypoglycemia awareness defined as gold score more than equals to 4 in each of the three subgroups. So you can see that the severe distress reduced from 32% to 30% in young old, it reduced from 37% to 18% in middle old, and reduced from 27% to 4% in old. When looking at the hypoglycemia awareness or gold score more than 4, it reduced from 40% to about 25% in young old, 50% to 35% in middle old, and 40% to 33% in old. So similar magnitude of reduction, and all of these were statistically significant. Next, we looked at resource utilization in the older cohorts of people living with type 1 diabetes. So we looked at hypoglycemia-related admissions, we looked at paramedic outcalls, and we also looked at hyperglycemia or DKA admissions. So again, the similar trend, this data compare the hospital admissions 1 month before starting them on the isCGM and 7 months following the start of the isCGM, because not everyone will have 12 months follow-up, so that was the median time to follow-up. There was a significant reduction in hypoglycemia-related admissions in each of the young adult, middle old, and old adults. So significant differences. So in summary, the study with older people with type 1 diabetes demonstrate improvement in the glycemic control, hypoglycemia awareness, and diabetes-related distress in young adults and old population with type 1 diabetes. In the middle old group, there was a significant improvement in diabetes distress, but non-significant trends in improvement in HbA1c and gold score. This study encourages use of isCGM in older adults living with type 1 diabetes. Thank you.
Thank you very much for your presentation. Now it's open for the discussion. Any questions, comments? I noticed that there is small amount of patients using pumps in your study. What are the rules to treat with pumps in this older group?
There are several criterias which need to be met in order for this patient to be eligible for insulin pump. So typically these are the people who either have poor glycemic control despite being on maximum MDI and support, or familiarity with the technology or their personal decision. So it's an observational study done across several 117 hospitals in the UK. So criteria might vary a little bit, but those were the brief criteria which were used.
Thank you. Any other questions? Thank you very much for your presentation again. Now we can move to the next one. Dr. Daltrey from UK.